Good afternoon, everybody, and welcome to the first ever Data Champions Online Healthcare. My name is Adam Plom, and I am a production director here at Carey, and I'm delighted to welcome you all here today. For those of you joining us for the first time, thank you, welcome, and we hope that this is the first of many. For those of you who have joined us before at a digital event or an in-person event, welcome back, and again, thank you as always. Before we jump into today's fantastic content, I wanted to take just a few moments of your time for a couple of housekeeping announcements. So firstly, throughout the entire event, each session has time allocated for our expert speakers to answer your questions. So using the Q&A module below, please do submit your most pressing questions throughout the session, and we will do our best to get as many of those to our speakers at the end of the session as possible. Secondly, in the unlikely event that you encounter any technical issues during the session, please firstly refresh your browser and relog into the system. If that doesn't work, we will simply drop the team a message in the Q&A module, and we'll be happy to do our best to help. Finally, you will also notice an array of downloadable content below, including our global, online, and in-person events calendar. So please do download that and as many other items as you wish, and feel free to read them in your own time. Now, with the housekeeping done, it's my absolute pleasure to introduce our first speaker of the week, Tim Carey. Tim is the Director of Data and Performance Analytics at Bane Care Management, and he is going to be discussing patient experience in the customer experience age. Tim will be sharing a number of real-life case studies surrounding the use of data analytics in the delivery of a superior patient experience, particularly during the ongoing COVID-19 crisis. Again, if you do have any questions, please do submit them throughout. And with that, I will step aside and hand things over to our first speaker, Tim Carey. Please welcome Tim.
Hi, everyone. Can you see the screen? Because my screen's just showing a blank white live view. Adam, can you see my screen? Cordelia?
Yep, sorry, Tim. I can see your slides. I can see the insider session first slide.
All right, my live view just shows a white screen. Okay, now I can see it. Let me know if you can see a slide that says a little bit about me.
Yes, we can see that.
Sorry, mine was perfect. At the very beginning. It's still on the white. So hello, everyone. Sorry about that. My name is Tim Carey. I'm the Director of Data and Performance Analytics at Bane Care Management. I have my LinkedIn profile here, so if we're not connected already, please feel free to connect with me, and we can collaborate on ideas for improving data and using data analytics to improve patient experience and quality care outcomes. And I'm a really big Simon Sinek fan, so I believe in having my why, which I have here, is really to use data analytics to help all levels of staff, from your nursing directors to frontline nursing, to use data analytics to improve the patient experience and the quality of care being provided from them. And something that I would like to ask the audience is, what kind of healthcare organization do you work for? And I'll leave this up for a little bit. Please answer where you work, so we can just get a rough idea of where the audience is coming from. All right, now I'm just going to go to the poll results and see what we have so far. Is anyone answering that question? Okay. Maybe we get some shy people in the audience. Second question, have you or anyone close to you been in a skilled nursing home or skilled nursing facility or nursing home? Either yes or no. We got some people have not. And I just want to go back to the other. Okay, we got some answers on the first one. We got health systems, nursing facilities, and health insurance. Thank you. Okay, and it looks like we do have some people in the audience that either have been to a skilled nursing facility or have maybe a friend or family member that has been to one. Last question for right now is, did you or someone you know have a positive or negative experience at that nursing home or skilled nursing facility? Interesting to see what the results will be with the audience here. Now let's give another minute. Now let's give a few more minutes to see if anyone else is going to answer the question. Looks like nobody has had a negative experience, which is interesting because a lot of media shows negative news that goes on. So interesting that not one person. Oh, there we go. Sorry, I apologize that some people did have a negative experience. What we're going to talk about today is how we improve that so that we have more yeses than we have nos. So as I said, I work for Bane Care Management. We have skilled nursing facilities throughout Massachusetts. We have North Shore of Massachusetts, the Boston area, South Shore, and then way out in the Western Mass, almost into New York State. We have a few facilities out there. And we really try to work, break down the silos within the facilities and try to have standardized care and work with each facility to really drive improvement with patient experience and quality of care outcomes. And I'm sure you all know since March 9th in Massachusetts, the Department of Public Health and the government officials came out and said there can be no visitors at all due to the COVID-19 pandemic at nursing homes, skilled nursing facilities, hospitals, and that's really tough. That's really hard, not only for the family members and visitors that want to see their loved ones in the facilities, but also those living in the facilities. It's really hard for them to not be able to see their loved ones, their family members, their friends that they're so used to seeing on a daily or weekly basis. This has really changed everything. Everything has been disrupted with the COVID-19 pandemic. And what we have here, we're starting to see some innovation going on with people finding ways to see their loved ones. In this picture here, we have a gentleman that had his own tree cutting company, and he brought his truck and got up in the cherry picker and went and visited his mom in the second floor. What we are doing now is we're actually providing iPads or types of tablets that residents can use with the help. A lot of them will need help with the activities director or activities staff in nursing to help them FaceTime and be able to see their loved ones through video conferencing, where, because they can't physically see them right now due to the restrictions that are in place currently. This is, helping them. And just to give a little background on Massachusetts, here's some graphs that I do on a daily basis for our team so that they can see, how we're trending in Massachusetts. The top graph is from yesterday. I updated this, and it shows, we are trending down in Massachusetts. It's not perfect, but we're heading in the right direction. And same, the bottom graph is the daily number of deaths, and the mortality rate, is starting to level off. It's higher than anyone would ever want. But we're making progress, and things are starting to get better slowly. And what we're really here for is this red area. So the patients' age groups that we typically care for are the 70 to 79-year-olds and the 80-plus-year-olds. And you can see here, they're the age groups that are really affected by the COVID-19 virus that's going around. And this is the industry. This is why we're doing what we do. The love that the staff are doing and caring for these patients, it's right here. The tears, the hugs, everything that goes on when someone passes away at a nursing facility or at a hospital. Unless you've seen it, it breaks my heart when I see the staff and the family members, what's going on in the patients. But they're true heroes. There's amazing work that's going on, and God bless the people that are at the front lines doing this work. So today we're going to talk about that patient experience. Even through this horrific pandemic that's going on, we're still providing high quality patient experience and patient care. And we use a lot of data that we're using through CoreQ. So if you're at a hospital, you would be known for Press Ganey. It's the standardized questions that a lot of hospitals in the United States use. In the nursing home industry, skilled nursing industry, we use something called CoreQ, which is apples to apples, very similar to Press Ganey. It's just tailored to our industry's format for questions. And we have a short-term survey that's done on anyone that is coming to the facility for short-term rehab, usually there for a week or two and then goes home. We survey them after they've been discharged home. They get a letter or paper survey that then gets mailed back to CoreQ. And then we do our long-term residents, the people that are physically living at the facilities for long-term care. We survey them once a year and see how we're doing. And we also use SurveyMonkey for our own internal purposes. So CoreQ is kind of the national standard that every facility is typically using. And we went through a lot of different vendors before going to SurveyMonkey. A lot of vendors charged a lot of money, didn't really cater to how we wanted it, and we're kind of concrete, and the questions that they'd ask were very basic, very anyone could have really come up with what they were trying to sell. So I kind of pitched the idea to our leadership team about, why don't we try SurveyMonkey? I mean, we could get a basic account, doesn't cost a lot of money, and we can do anything we want with it. We could survey our patients, we survey our employees, basically any survey you can create, you can use. And so the idea was, let's pilot this with a few facilities, and now fast forward a few years where all of our facilities are using it. And we created an admission survey that we use on every possible patient. So when they come to our facility, we're usually surveying them within the first day or two, so we can get that pulse check to see, how are you doing? How are we caring for you and treating you as a person? And if we're missing something, let's catch that and use the survey and that data to really drive change and say, maybe it's something like your TV's fuzzy and you really love watching, sports, which we know sports aren't really happening right now, but or you love the news and it's very fuzzy. Well, we can get someone from maintenance to come and fix your TV. And, we use this type of survey to capture that, the minor little hiccups that maybe we missed, we can fix. And then when the patient is discharged, the social worker is already making a follow-up phone call with the patient. And we've kind of incorporated that phone call, the questions that they were already asking. We just kind of tweaked it a little bit to meet the needs that we know we want to set a high level of expectation of when they're discharged. Are we capturing the right patient experience data, and when they're home, are they successfully at home, or is there anything that's maybe missing? Like they had home equipment and that home equipment never showed up. So now they had visiting nursing set up, and that nurse never showed up on day 2 or 3 upon discharge. So we have things that we can escalate up if things aren't working the way we're expected and our expectations are. For core Q, so for the standard data sets that we have, it's over, in our database that we're attached to in core Q, it's over 300 SNFs or skilled nursing facilities, nursing homes. You can see a lot of our facilities we benchmark on this 10%, the best of the best right here. They're averaging 81 and 83, I think. Sorry. There's a lot of our facilities you can see that are in the green. They're hitting that, and the 2 that are not are actually technically they're in the top 10% because it goes from 81% to 100. This is just the average. So we're doing something right in our facilities, and all of everyone's above the core Q average for our facilities. So we strive to do the best that we possibly can, and some of this data here reflects that the hard work that we've put in, it's showing, and that we can still strive to do a better job than what we're doing now. And then for SurveyMonkey, it is seriously extremely easy to use, very easy to set up and analyze. You can, I just took a screenshot of 2 of our surveys that I showed before. You can design them, send them out. You can analyze them, share them. It's super simple. Some of the questions, we ask upon admission, we want to really touch on the points that the patient is, when they first arrive, is someone explaining what to expect at your stay? So you've come to a skilled nursing facility, you've never been here before. You probably something happened in your life that you went to the hospital, something, you broke your hip or broke your hip, came to the hospital. Hospital discharges you after, a week or 2, or maybe less, and they send you to a skilled nursing facility, and you've never been to one before. Our expectation is that someone is physically going over kind of what we've created, a what to expect sheet. So what's going to go on, like when you're going to get rehab, when you're going to see nursing, when your meals are, what's the TV, the internet, and sources. So it's important that we touch on those, human aspects, and know, like, if their preferences, maybe they like to shower in the afternoon versus the morning, or maybe they like to shave in the evening or, instead of the morning. And any concerns that they might have or questions, are we answering those questions and addressing those concerns the way we would want to be if we were in their shoes? So these questions here are really helpful for us to know, are we doing what we expect is going on? And if not, where can we do a little bit better? And we have little kind of comment questions where they can say what's working well and what's not working so well. So we can, keep striving to do things that are working well. We want to keep pushing for that. And things that maybe we fell down and we aren't doing what we thought we were doing. Well, here's where we know we can do a little bit better and use this data to drive that change. And then on the other side, when the patient, is now successfully discharged home and they're home for a few days, that social worker will call the patient and go over some questions. And some of them, did anyone go at this facility go over your discharge instructions so that you are educated and you're ready to go home successfully? So your care plan, your medications that you need to take. And sometimes there's a lot of change between medications from home to hospital to nursing home, back to going home. A lot of those medication lists can change. So are the staff educating the family members and the patient on those changes and how to manage those medication on a daily basis, and follow-up appointments with your primary care physician or specialist, any visiting nursing that's coming by, making sure that everything's set up the way it needs to be, and then looking at general questions like overall care given and likelihood of recommending the facility to others. This helps us know, are we doing a good job, that you think you had overall good care, and would you your likelihood of recommending us, maybe it's a family member, a friend, a neighbor, someone in your community. If you had a positive experience with us, we want to, hopefully that's a way to help other people have that same experience that you had. And we can really tailor this to be designed anything we want. So, for example, if two of our facilities have a CHF, our heart failure program, going on right now with a COVID-19 in place, it's kind of, a lot of stuff is kind of on hold, on freeze. But when we're fully open and operational, we can tailor these questions. So the hospitals, the ACOs that are referring patients to us, we can say, look, you have a heart failure program, we have a heart failure program, we're collaborating with each other, and here's some data that we're actually capturing from when the patient comes from the hospital to the skilled nursing facility and goes home. We have metrics in place that we can actually see, is the care coordination and that pathway, is it working the way we all thought it would? And if it's not, here's some metrics that we can use and escalate when issues are brought up immediately to the right people at the right time to take care of those issues. And then, SurveyMonkey, it's very, 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 very easy. The analytics, we opened up SurveyMonkey, and the analytics are ready to go. Some minor things that I've made is on the right. This is right out of the box how you can analyze questions. You can trend it over time. You can do a lot of different analytics with this. You can export it to Excel if you want, like a big giant data dump. But I created on the left, I created on the filters all of our facilities. So I can easily just click, and then I can see all the questions, all the answers and responses for each of our facilities. So we work with individual facilities and let them have access so they can see their own data. They see each one as they're completed, but this is if they want to go back and say, let's look at this over a month or over a week or over a few months. It's super, super simple. And some things that we've taken out of our patient experience data from SurveyMonkey and CoreQ, that I talked about that what to expect sheet. A few years ago, we were finding in our admission survey that, staff weren't always explaining what to expect the way we thought they were. And we were getting a handful of comments from patients and their family members saying, I was here and 10 minutes, no one ever explained what to expect. So we came up with, collaborated with our facilities, and we created this what to expect sheet that goes over. It's a simple 2-page front and back sheet, or 1-page front and back. And staff can easily go over it with the family members and the patient to explain, the rehab, the nursing, the meals, who to contact if there's any issues, Wi-Fi, the television, visiting, a lot of different things that are just easy for them to digest and understand. We've improved food tray accuracy. So if you ordered pancakes in the morning and you got waffles, well, why did that happen? Or I ordered scrambled eggs and they came cold. Well, why did that happen? We can start diving into our own data and start looking at process improvement efforts and really make some change there. We can help with call light issues. I think every hospital, every nursing home, everyone, call light is an issue everywhere. What can we do differently to address that, especially on the night shifts? Why is it always at the night shift that it seems to be a bigger problem than the day shifts? Helping to address staff behavior. Sometimes, you have excellent staff. Sometimes you don't. And these surveys really help capture that. Maybe someone has their behavior isn't what we expect, or our expectation in our training is. We can identify that through these patient comments, and on the other side, help address the amazing work that's going on, and really shine on the staff that are doing an excellent job. Let's highlight that and show them, like, look, you have some really remarkable, skilled staff, and they're doing an amazing job. Let's show what the staff, the patients are saying in their comments. So I want to stop and freeze for a second and just kind of ask a question again. Based on personal experience, or that maybe someone close to you, what is your experience with food and meals at a healthcare facility? It could be a hospital, it could be a nursing home, skilled nursing facility. And some stuff to think about is, accuracy, the ordering, the quality, temperature. And, I think of a couple of times when my wife was at the hospital for our two sons being born at two separate times, ordering something for breakfast, and what you ordered wasn't what showed up, or you ordered, like French toast and it came cold. Why does that happen? And, looking at, why is healthcare food always, lowest ranked? Well, what can we do differently to improve that? So I just want to kind of hear from you and see what your answers are on this. I'm going to see what we have so far. So far, indifferent. Okay. So again, we're using the data for this to really, I want to really see the good and the excellent. No one's really going to a skilled nursing facility or a hospital for their food, they're really going there for the care, but food's important. It's something that we strive to always make better wherever we can. And hopefully, over time, you'll start to see that food quality and accuracy really go up. And we've had some process improvement projects at certain facilities to really drive that change, where the food accuracy is significantly better than where it was a year ago. And so with the SurveyMonkey, I just want to say what we are able to do with the SurveyMonkey results is really, I export it to Excel so we can kind of look at it in two different ways. On the left side, this is what we use for our process improvement, our quality assurance process improvement. And on the right side, this is what we use for marketing and what we kind of share with hospitals and our ACOs, our partnering referrals. So when patients are at the hospital and they're picking what skilled nursing facility they want to go to, the hospital, typically a lot of them have tablets now where you have a list of skilled nursing facilities to pick from. We actually have this as one of our pictures. So as the patients are scrolling through different facilities and looking at all the pictures of the facilities, we want them to see, like, hey, if you pick us, if you come here, this is what other people have said about us, and here's like the metrics that we have on that patient experience, and just really helps that person, hopefully pick us as that choice of care. In some patient experiences comments, there's a few slides here. I'm not going to read them to you, but I just want you to know, like, these comments are coming during the pandemic of the COVID-19 pandemic. So as things are horrible things, people getting sick, people are dying, we're still having positive things happen in the facilities. Patients can't see their family members, but we're doing everything we can for them to see. Here at BayPath, we had a wonderful shout out to some staff. This is the heartwarming comments that we really want to be sharing, not only with the staff, but with everyone, and say, look, there's positive things going on at skilled nursing facilities or nursing homes. Even during this pandemic, there are really positive things happening. And you can see here, some people have been to other skilled nursing facilities and wouldn't want to go back there, but they would absolutely love recommending going back to Seacoast, one of ours. You see some really special things. Nurse Meg, they're calling people out. And so we share this with the staff. So say, look, certain patients have called you out. And, we even recommend if you had a really positive experience, let's get those comments, put it up on Google. Everyone's Googling everything. So it's important to have, if you, had a really positive experience, or if you didn't, that's, try to make, everyone have a positive experience, but, put those comments up on Google so we can see it and other people can read what you've experienced. So with that, I just want to end and ask if there's any questions at all. I really appreciate you taking your time to hear this, and I'll share anything that if you want, just let me know. Thank you.
Fantastic. Thank you very much, Tim. Very much appreciated. I know you and I have discussed this before, but I love the human element to all of this stuff, that data analytics plays such a pivotal role in very sort of marginal changes, but ones that have a big impact on people's patient experience. I think it's absolutely fascinating. A reminder to the audience, we have had some questions already come through, which I'll run through with Tim in just a moment. If you would like to submit further questions, please do. We have time for several, so we'll try and get as many of those answered as possible. So Tim, first question for you that we've got here. On a practical level, what are some of the success strategies that you've had in improving data literacy amongst non-data colleagues?
Now, isn't that a question I love to hear? So that is something I strive greatly towards. It is very challenging. It is not easy. I worked at a hospital for 5 years before coming to Bane, and now I've been here for a few years. And, it's a challenge. Data literacy, for people like us, it's easy. But you go and you start talking to a nurse director, or not to pick on nurses, I could say physicians or in any clinical leadership. And, maybe they've been a nurse for 20, 30, 40 years. And now you're starting to throw pivot tables and graphs at them and all this data and all these reports that they're now responsible for, with internal reporting, state reporting, federal reporting, reporting to hospitals and ACO, CMS as our Medicare platforms that, everyone's saying, all right, we want to partner with you, but we need to start sharing data and have reports that we know things are working well or not working so well. And there's a lot of nursing leadership that they have all the clinical skills under the sun, but they really need a lot of help with the data and understanding what the analytics is showing them and how to use it. So, I've been, teaching classes, little mini courses at our organization. I even did, kind of how to use pivot tables with our finance team so that you can, help them, and doing the same with our clinical teams little by little, and really helping them. And, I send them information and data all the time and showing them, like, here's little things that you can do and learn. But it's a challenge because you have some people that will embrace it and some that won't. And, it's not just people that are, 20, 30 years into their career. We get nurses right out of grad school or undergrad, and they still don't understand data in there right out of the nursing program. So it shows to us that, nursing programs are for clinical, but there's a bigger need. The nursing programs need to really be educating and training nursing students and clinical students more about data analytics in the programs, so that when they come to the floor and they start becoming a nurse or a nurse manager or a nurse leader, they're prepared and they're, train them to be successful. So it is a challenge, but it's a work in progress. We keep pushing for it, keep pushing, never give up.
Fantastic.
Sorry
Thank you for that.
Long on that one.
No, not at all. Not at all. No, very good answer. The next question we have here actually kind of ties into that a little bit. So how has the COVID-19 crisis changed or altered the demand for data and analytics within your organization? And what has that meant for your role?
Oh, man. So it's overwhelming. So we have our own internal reporting. We report our metrics, number of cases, and we have certain metrics that we post on our website so that family members can see and anyone in the public can see. But we post that daily. Then we have the hospital partners that we work very, very closely with. They have some metrics, daily metrics that they want on a daily basis, especially like when a nursing facility has a lot of COVID patients, there's going to be an admission freeze. So no one can come in. So the hospitals need to know that because they have patients at their hospital that now need to be discharged, and they're looking for what skilled nursing facilities can accept who and when. So there's a lot of reporting there. Then you have your federal government and your state government, all asking for data. And unfortunately, the state and federal don't ask the exact same question to the exact same answer. So it's not like you can say, here's our data, and we can answer two different organizations in one shot. They ask it a little bit differently. So you have reporting for the federal government. Then you have basically the same data, but sliced a little bit differently for the state data. And that's a lot. It's a lot of work for the facilities, and I'm helping them out as much as we're doing a lot that we can do. But there's a lot of like silos that we're seeing between the state and federal government. That if they just collaborated a little bit more together, it would be a lot easier. But that's where we live today. Does that make sense? Absolutely, and we're covering all the data buzzwords at the moment with data literacy and now silos as well. It wouldn't be a Data Champions event without talking about that. So the next question we have actually is an interesting one. So how do you think that patient experience expectations are evolving, and how far do you think this is driven from customer experience expectations from outside of healthcare? I hope that the expectations are high, because if I was in their shoes, I would expect, high customer experience or patient experience for myself. So I strive, I know our organization strives for that, but I strive that the entire industry, the entire country strives for that. And I know there's organizations that are really good. There are some not so good, and there's some that are really not so good. And I would really like to see everybody step up and really provide the best patient experience that they can. And thinking of customer experience, I always go back to our food tray. When the food tray isn't accurate, to us, we just think like, that's so simple. Why are people not getting what they ordered? If I ordered mashed potatoes, why am I getting, French fries? That just doesn't make sense. So when we ask the kitchen staff and the diet aides, we find little things like maybe the diet aide, English is their second language, and they don't know the difference between things like, I'll give coffee as an example. Someone asked for coffee with cream, and they get coffee with milk, or they get coffee with sugar and they ask for sweet and low. The diet aids sometimes, their English being their second language, it's hard for them to know the difference that milk and cream are two different things, and sweet and low and sugar are two different things. And for the kitchen staff, I always tell them, like, if you went to a restaurant 4 times or 3 times or 2 times and you ordered a cheeseburger and you got pizza, would you go back to that restaurant? Probably not. So that's kind of what you're doing to the patients when they're ordering something and you're giving them something that they didn't order without communicating at all. That's exactly what you're doing to them. And it's giving them the understanding that when you just make a decision without communicating it to the patient that ordered something, you're messing up their experience. So you're giving them a poor experience that's completely avoidable. So I try to translate to our staff that kind of way of, like, if you went to a restaurant and then they get that, like, aha, I understand, like, why you're so crazy on fixated on our food tray accuracy. And it helps everyone. And now the person, the patient that's ordering what they ordered is getting what they ordered. And it's, if it's supposed to be warm, it's being delivered warm. And that's really important to me and to everyone at our organization. And we're getting the staff to really see the value in that.
Fantastic. I think we have time for one more question, actually. Sure. And we have a good one, actually, to sort of round off here. So I guess looking forward to the future, the next frontier of all this stuff, how would you like to see your organization, other healthcare organizations using data analytics to help improve patient experience? I guess, how far can this go?
I definitely would love to see a lot of the paperwork that goes on to slowly go away. We are in the year 2020. It would be so much easier and more efficient if, you could email someone a link or a way. But right now, there's still a lot of handwriting going on in healthcare. And I think, it comes with a lot of various people at various stages in their life that have various understanding of how to use a smartphone or a tablet or a computer. Some people know how to do it very well and some don't. So I would really love to see that we start using electronic devices a lot more so that we can capture real data faster in real time. Right now, like the core queue, it's great, but it gets mailed. And so, like, the person goes home, you send a discharge list to the core queue team. They get that usually like a week or so after the person's been discharged. Then they got to mail it to the person. So now, like, you're looking at probably like 2 weeks before the person actually even gets this form. And they may, 40% probably don't even, or 60% don't even fill it out. Why couldn't they just get that on, like, the day of or a day or two after their discharge? Like, get that out to them and email it versus all this paperwork that goes on. I think there's a lot of lag that the entire country needs to, like, move towards electronic use versus paper forms. Does that make sense?
Absolutely it does. And with that, actually, I think we're probably just about at time. So, Tim, thank you so much for a fascinating opening session. And I'm sure I speak for all of the attendees when I say thank you to you and all of your staff for the work that you guys are doing all the time, but especially right now in the current environment. So thank you very, very much. Thank you as well to all of you, the attendees who submitted questions for Tim. Some great questions in there. So thank you very much for that. As Tim mentioned at the start, happy to connect on LinkedIn and continue the conversation should you wish to do so.